The health insurance company NIB is planning to launch a website where patients can rate the performance of healthcare specialists like dentists, physiotherapists, optometrists, among others. Whitecoat.com.au will allow consumers to discuss good and bad medical experiences. Ron McKenzie is the fund's Chief Marketing Officer.
Well, there'll be three aspects of ratings, I guess, that we'll be able to provide on some of the practitioners. The three aspects are a likelihood to recommend score, a service charge score, and then customer comments that are left by our customers. So in the customer comments, there will be the opportunity for people to both criticise and to praise the provider. And I do want to point out that over 90% of comments that are so far on Whitecoat have been overwhelmingly positive.
Just what can a customer say in that comment section of the website? Can they say, for example, that their dentist is incompetent or arrogant or even has bad breath?
Well, our moderation guidelines are published. Our customers are allowed to say anything that they believe is truthful about the provider, but not that's defamatory or in any way inflammatory, and as per our moderation guidelines. So, in your example, if a dentist did have bad breath, they are allowed to say that on the website.
Now, you haven't got doctors, GPs or specialists on the website. Aren't they the most important people in the whole medical process? Have you left them out because you fear you'd have a fight on your hand if you were to include them?
No, the main reason we've not included them is that as a regulated health benefits organisation or health insurer, most of our claims are either with respect to specialists in hospitals or extras providers like dentists and optometrists. So we've focused on providing ratings on dentists and optometrists and what we call extras providers rather than specialists in hospitals.
Now, a person's treatment, of course, is a lot more complicated than rating, say, a car or a restaurant or a movie. Is there a danger that specialists who have to deal with a patient's condition that is complicated and tricky will be worse off than one who's presented with a case that's easier to treat?
Look, this is no doubt the treatment of a health need is more complicated